And welcome to another episode of The Benefit Whisperer with Ralph Weber. Ralph, I usually ask you how things are going, but I want to jump to that number right away because that's a very disturbing number, and I think people ought to know more about what you're talking about today.
It is very disturbing, Bill. Every minute, as I just said, every minute in America, every minute a family declares bankruptcy due to medical reasons. 2/3 of all bankruptcies are due to medical reasons. It's a huge number. There are over 530,000 families that declare bankruptcy due to medical reasons every single year. And guess what? There are 526,000 minutes in a year. So I'm literally talking more than probably every 58 seconds or something like that. It's crazy.
Yeah, I have to tell you, Ruff, when you shared the notes for this episode with me, and I looked at these numbers that we're going to be talking about today, I kept thinking, I think Ralph made a mistake. And I know you're not the kind of guy that makes mistakes.
No.
So I thought maybe there's some other problems here that we need to be talking about, as a matter of fact. I don't care who you are, where you stand on the political spectrum or anything else. Those are disturbing numbers that demand our attention.
Yes, they're very disturbing, Bill. And we don't get in this country better outcomes than most countries. As a matter of fact, we're kind of the middle of the pack. I don't know the exact number, but our life expectancy, our health, our morbidity, we're not leading the pack. We are leading the pack in spending.
Mm-hmm.
We're leading the pack in medical bankruptcies. So, as I've told you before, we spend over $5 trillion a year on healthcare, which is bigger than the GDP of any country except the US and China. And Germany, who's the third biggest GDP in the world, 80 million people,
Mm-hmm.
their GDP is like 4.87 million. So we spend more on healthcare than their entire GDP. So 80 million Germans would have to work around the clock just to pay the US healthcare expenses. It's that high.
That's astounding. And look, we could do a year-long worth of episodes about how to fix it, but we're not here to talk about how to fix it entirely right now. We're going to focus on this medical debt that is creating these bankruptcies today. So why don't you just jump right into this, because there's nothing I can say about it except sort of stand back in dismay, I guess, in some ways.
Yeah, no, absolutely. Over 100 million Americans, 1 in 3 Americans have some medical debt. 20 million Americans have substantial medical debt.
What does that mean? Can you put a number on that?
According to the Health System Tracker, which is KFF, substantial, they have a threshold where it's actually not something you're going to pay off this month.
Okay.
However, that
you're going to carry it over.
Exactly. Okay. So, I mean, it's one thing to say, I'm going to put on the visa, I'm going to pay my visa at the end of the month. It's another thing to say, I'm going to put on the visa and pay it down over time, right?
Mm-hmm.
So GoFundMe, 1/3 of all GoFundMe campaigns are for medical needs. That's about 250,000 campaigns a year. So that's one every 2 minutes. Okay, every 2 minutes, somebody goes to GoFundMe and says, I have medical debt that I cannot handle. Please help me to contribute. And GoFundMe raises $650 million annually, but that's less than 12% of the people that actually reach their fundraising goals.
Just before we go on a little bit further, I'd want to understand that a little bit better. You're saying that there are GoFundMe campaigns every year which raise roughly $650 million a year, but
Yes, correct.
of those GoFundMes, only 12% ever reach the goals that they're looking for?
Yeah. So putting it into perspective, if 650 million is 12%, then 100% would probably be over 5 billion. Okay, that's how much they're trying to raise. And they fall short, but they raise some.
Wow, that's great.
And they need this money. And most people that have medical debt have insurance. Okay, it's not people that are uninsured. Our uninsurance rate is about 10% now in this country. So most of the people that have medical debt have insurance.
That is deeply upsetting. Can you give us an example of what some of these GoFundMes look like?
So somebody that I came across that is trying to raise funds on GoFundMe, his name is Ronald. He's right here in Houston, Texas, actually in Bay City. His goal is to raise $22,000. As of the time of this taping, he's raised just over $16,000. I personally have contributed $100 to his campaign. What he says is that a couple of weeks ago, he fainted and fell on a piece of furniture, causing it to break. And he realized that he had some pretty serious heart issues. So he, was starting to sweat. He was drinking water. He finally went to the doctor. He was taken to emergency room actually several times, and the bills just kept piling up. So he is trying to raise $22,000 to help him with his medical debt.
I realize that there's not a lot you can tell us about his particular situation right now, but can you promise listeners that you'll keep them updated in the show notes and let them know what's going on?
Yeah, absolutely. I'll post it in the show notes. And also, if you go to thebenefitwhisperer.com, we'll have a link there with some updates on Ronald and a place to go that links right to his GoFundMe campaign. Like I said, I've contributed $100. If you want to contribute 10, 25, even $5, every bit helps.
Absolutely. Absolutely. Now, I know this is a terrible personal tragedy for a lot of people, and we've already established that really well with the numbers that you've been discussing so far today. But it's also an employer problem, right?
Yes, it is. It is.
Mm-hmm.
It is. The average employer will pay roughly $16,000 per employee for healthcare costs, okay? Now, for single coverage, it's about $8,500 per year. For family coverage, it's almost $26,000 for a family. Okay, so that's huge. Now, of course, that's split between the employee and the employer.
Right.
Okay, but it's a huge cost. So you might as well say that when you hire an employee on top of his or her payroll, bank on contributing. Even if you split it with them, bank on at least $1,250 a month. More for families than singles, but it's this huge extra burden that you have to pay.
Yeah, no, I think I've shared this with you before. I have a friend of mine who has his own company, and one of the hardest conversations he has every year is a conversation with his accountant, who's always saying, you need to lower cost. And he said, you need to raise the deductibles. And, and he's got 20 guys, and these 20 guys have been working with him for quite some time. And so they're in essence like family to him. And he's like, he said, it kills me every time, Bill. It kills me every time I have this conversation. And he's, I say that because I don't want people to think, employers are unfeeling groups of people. This is a huge financial burden, and it does torture them, doesn't it? Right? You know better than me.
Yeah, absolutely. Absolutely. And from the business owner's, perspective, the CFO, the CEO, they want to reduce costs. As we've discussed, benefits are usually the second biggest line item after payroll. And I've talked about the fact that Starbucks spends more on healthcare than they do on coffee beans. General Motors spends more on healthcare than they do on sheet metal. It's huge. It is such a huge burden. Increasing the deductibles doesn't help. Okay, in the short term, for 1 year, it might decrease premiums a little bit, but over 34% of individuals put off medically needed procedures or prescriptions because they can't afford them. Okay, and increasing the deductible just means more people will pull that off. What that results in, Bill, is even more serious medical conditions. I mean, putting off something that you need, over a third of people putting off something that they need because they can't afford it. If you increase the deductibles, even more are going to do that. So in the long run, it's going to spiral and exacerbate the problem.
What do? You work with these employers. That's what you do. You work with employers to grasp and wrestle and get these costs under control.
Absolutely. And, like I said, short-term thinking is let's increase the deductibles, let's increase the copays, et cetera, et cetera. But that is short-term thinking. Okay. It kicks the can down the road. Okay. But down the road, you're going to have a more serious problem. Okay. Get your employees involved. And I've talked before about self-insurance. In most states, you can have a self-insured plan with 5 people or more. Okay. Since the ACA passed, self-insurance has evolved even more. And there's a product called level funding.
Mm?
Okay. And if you go to refundhealthplan.com, you can learn more about that. Level funding means that you pay, there's three costs fall into 3 buckets. On a fully insured plan, you have a premium. You pay a premium, the insurance company pays your
Right.
claims. Okay. Since the ACA passed, that premium is set on no matter how healthy or sick your group is, you pay the same. With level funding, your costs are broken down into 3: administrative costs, stop loss insurance for big claims, and claims funding for small claims. Okay. So at the end of the year, if your claims are low, and most of the time they are, then you get money back. That's why it's called a refund health plan. Okay. That is a great way to reduce costs. Studying the claims. Okay. And that doesn't mean seeing, what kind of treatment Bob went for or Mary went for. No, you should not be looking at that. Where are they going? Are they being charged a lot of money? What kinds of treatments are they getting? What kinds of providers are going? And I told you before about, in the state of Tennessee, we studied health claims. For a CT scan, the average was $635. The high was $19,800. So looking at those claims, looking at what was paid, the drug spend is also huge. Okay. The drug spend, I've seen variations in pricing. A drug that cost $10 being sold to an employer paying $100,000 for that same drug. So selecting the PBM, and we'll have another episode all about PBMs that embraces the Mark Cuban cost plus drug formulary. Okay. Sometimes importation from tier 1 countries can reduce costs. So looking at the drug costs, that alone, because drug costs used to average about 10% of the plan spend. Now it's anywhere from 20 to 40% of the total cost. It's crazy. Do you know, you're never going to I'm going to let you guess this. What is the most expensive prescription drug in the US today?
I don't know, because I've heard some crazy numbers, Ralph. Okay. So, I mean, I literally don't know. I feel like I know like weight loss drugs are $1,100 a month. That's insane.
Okay. $4.25 million.
Excuse me.
For a prescription drug, $4.25 million. There are 10 drugs now that are over $1 million.
Are you serious?
I'm serious. I'm sadly serious. That's crazy.
What are these? Wow, man, that is mind-boggling. What do these drugs do?
Well, I'd like to say, do you remember the $6 Million Man, Steve Austin?
Yes, exactly.
I'd like to say they make you run 60 miles an hour,
Right.
but they don't. They don't. And they're not, no drug is 100% effective, and the thing is that these huge burdens are burdens to employers, they're burdens to employees, and they're causing bankruptcies. Okay. So the drug spending, the medical spending, the spending is really high, and the results are not commensurate with that spending. So we have to drive down the costs. We have to do that by employers saying, look, I have a business within my business. My business is making widgets, making coffee, making cars, whatever it is. But within my business, I have another business, and it's called my health plan. If you take that $16,000 number, if you have 100 employees, you might be paying $1.6 million for healthcare costs. $1.6 million a year. That's a business. And that's not a tiny little business. That's a decent sized business. You need a CFO overlooking just your health plan, Bill.
Wow. I mean, and it is hard. It is hard to run a business. So, I mean, you were talking about adding I remember at one point if I was in management, and I remember, that it's like I've forgotten what the cost was, but it was like if you knew you were going to hire an employee, you needed to add another 25-30% onto those costs for all of the benefits and everything else that went with them, right? It sounds like now that number has risen to probably 50% or better.
Pretty close, Bill. Pretty close. I mean, you've got your employment taxes, your FUTA, your FICA, your Medicare, Social Security. You got that kind of stuff, which That alone is probably about 14%.
You got no wiggle room in that. The government says this is what you pay.
Exactly. Then you've got your healthcare costs, and it's mind blowing. It's mind blowing.
What can we do? Let's go back to this medical debt bankruptcy problem and the employer's role in this. And I don't mean it's their role as in it's their fault, but what can employers do for their employees to help with this?
There are a few lawsuits right now filed in the U.S., 3 to be specific, that allege that the CEO, CFO has breached their fiduciary duty by using a supplier that charges too much. Okay. We'll do a whole episode or 2 on this.
Wow.
Okay. So I don't want to get too deep into the weeds, but CEOs, CFOs, HR departments are under increased scrutiny. Okay. Because their employees are saying, hey, look, I'm contributing a portion of my premium. I'm paying 20% of the cost. Plus I'm paying deductibles, copays, et cetera, et cetera. Okay. And if you think that the out-of-pocket cost for a family are approaching 20 grand, okay, they're like $18,000 and the premium is $26,000 on top of it. There's potentially a huge burden. So if I'm an employee and you are my employer, I'm saying, look, I'll contribute a part of the premium, but you have to do your job and find a cost-effective plan.
So it sounds as if these 3 particular cases have the potential to ratchet up awareness in terms of cost and what can be done, right?
Absolutely. Yes, absolutely.
Wow.
Yeah. We have to, Bill. We have to. We have to focus a lot more on that business within our business. Gone are the days when we can just jump from one insurance company to another, to another, to another. That doesn't fix the problem. That kicks the can down the road. And sometimes an employer, HR department wants to hit the easy button for a year. I get it. I totally get it. I don't have a problem with that. But do it as a temporary thing and then take the time to study it. Get a competent consultant that can help you, that can examine these costs, that can look for alternatives. That's the long-term solution.
Well, for those who are listening to this program, those employers who are listening to this particular episode, and that's what this podcast is aimed at. This podcast is aimed at folks trying to get a hold of their healthcare cost. And they want to have a conversation with you about doing that, Ralph. What is the best way for them to reach out to you?
Well, they can email me, ralph@thebenefitwhisperer.com, or they can call me, 832-924-3330.
Great. And I would encourage you to do that. These costs are very real, as you know. I don't have to tell you that. The other thing I would encourage you to do is, if you're not a subscriber to this podcast already, hit the subscribe button, hit the follow button.
Absolutely.
Yeah.
We're going to have a lot of episodes, Bill. We're going to get into the weeds on a lot of things. We're going to get into the weeds on drug spending, prescription drug spending. We're going to get into the weeds on self-insurance. We're going to get into the weeds on health reimbursement accounts, all kinds of stuff. There's all kinds of stuff to explore.
Exactly. And by the way, in one of the earlier episodes, you went a little deeper into the whole concept of level funding. So if people are listening to this and wanted to explore that a little more, look through the list of episodes and they can get a little bit better idea about that. And the other thing I would suggest, is if you like this podcast because you find it helpful and useful, tell other people about it. Word of mouth promotion is really welcome. It's great, especially in this day and age when you don't know who and what kind of bot is, recommending things to you. So word of mouth promotion is very welcome, and we would appreciate it very much. We'll catch you next time.
Thank you for listening to the Benefit Whisperer podcast. Click the follow button to be notified when new episodes become available. Looking to reach out? Visit our website at www.thebenefitwhisperer.com or give us a call at 832-924-3330. And don't forget to click the follow button to be notified when new episodes become available. The information covered and posted represents the views and opinions of the guest and does not necessarily represent the views or opinions of the Benefit Whisperer. The content has been made available for informational and educational purposes only. The content is not intended to be used as a substitute for professional investing advice. Always seek the advice of your financial advisor or other qualified financial service provider with any questions you may have regarding your investment planning.